From the Toronto Star, I'm Reggie Mudler, and this matters. Numbers don't lie, but what they tell us isn't always clear. With the current spike in COVID-19 case numbers in Ontario and across Canada, there are a lot of questions as to what comes next. Is this the second wave? Where are we in it? Should we be shutting everything down? Have we learned anything from the spring? Today, Ontario reported 478 cases, with 153 new ones in Toronto. That follows a 7-day average where we've seen the case numbers double. These are not good signs. To discuss this latest spike in case numbers, what it means, and what we still don't know, we are joined by Ed Tubb. He's an assignment editor at The Star focused on crime, justice, and COVID-19 data. His work has helped inform several articles, and he expands on it on Twitter at Ed Tubb. That's Tubb with 2 B's. Ed, thank you so much for being here today.
Yeah, not a problem. Happy to be here.
So, Ed, I know you've been tracking and following these numbers for us, but you're doing it a little bit differently from sort of the officials. Let's start with your methodology and why you're doing this.
So when we were first getting COVID coming into Canada, coming into Ontario in the spring, what I was noticing at the time was that province and the country as a whole was behind on putting out good data. What I was seeing from the local health units in Ontario, so Ontario has 34 individual health units for different regions in the province. And I was looking at those numbers and I was seeing that things like cases being reported by these local health units weren't showing up in the provincial data for several days. So at that time, I thought, well, you know what? It's easy enough for someone like me or anyone to count all this stuff themselves. So that's what I started doing. So what I've been doing since, like every day since March, is I've been counting and keeping an eye on each of the individual public health units in Ontario. So that's all 34 of them, and seeing what they're reporting. And what they're reporting ends up being a pretty similar number to what the province puts out, but it's a little bit different. It's a little bit ahead in some places. It's a little bit more detailed in some places. In some places, it includes some different information. I think it's all useful, and I think it's useful as like a double check on what the province puts out. Back in the spring, the province was pretty poor at putting out good data, and they've got better. So this is one way that I've kind of put pressure on them to get a little bit better too.
Love it. I'm glad that we have people who are double checking because I am a mathematically challenged journalist. So one of the reasons we have you here is because I want to talk to you about these numbers. We are all seeing this spike. I think we are all getting concerned. You're looking at these numbers. Take me through them.
Yeah. So think back to March. Think back to the spring. There was the first wave. We were really scared, and these numbers started flooding in. They hit us hard. And in Ontario's peak in sort of mid-April, we were hitting about 600 new reported cases every single day. And that's 600 people getting COVID, getting tested, and coming back with a positive result. And that was the peak. And it slowed down through the spring and through the summer after that until it kind of lulled. And it hit a real lull around August. And that's when, Toronto and Peel region finally entered stage 3. And since then, since that time, that same case number of the daily number of people who are getting COVID and testing positive has gone up really, really quite fast. And it's kind of accelerating. It's not just going up, it's going up faster and faster and faster. So that's what I'm watching today. And that's what I'm most concerned about. So we're not back yet to 600 cases a day, but we're not that far off. And at the rate that this number is doubling about every 10 days at the moment. So with a number that I'm seeing around 350 cases a day, well, you can do the simple math. It's not hard. So 10 days from now, sort of early October, that's about when I'd expect us to be back up to around 600 cases a day if everything holds, and it may not. But I think, that's a pretty safe projection that if things stay as they are, we're going to be back to the same peak in confirmed cases by about early October.
A couple of things that I want to dig into. On Twitter, you said the 7-day average has doubled in 10 days. The other thing, too, is 552 is the most since your count since April 23rd. And we've also seen the biggest jump in 3 months. Is that all correct?
Yeah, that's all correct. So I pay attention to the daily number, the daily change. what I pay more attention to is the 7-day average. And that's because, the numbers have a bit of a cycle to them. Some days of the week are going to have higher numbers just because these numbers are reported by the public health units. So some of them are less staffed on the weekend. So they will report a bit of a backlog on a Monday. I did count 552 cases on that Monday. That is really high. That's in the top 5 to 10 worst days that the province has seen. But the number I care most about is the 7-day average. And that 7-day average as of Monday was up to 350 cases a day and rising. The thing you need to be worried about is that it's rising fast. Now, all of that said, there's a good thing to keep in mind. And that's that, yeah, we're in a second wave, but we don't know where we're at in a second wave yet. And that's because back in March, this was all brand new to us. It was not just brand new to you and I, the public. It was also brand new to public health officials. It was brand new to doctors. It was brand new to people testing. It was brand new to the province, right? So we weren't prepared for it in the same way that we might be now. But we also weren't testing nearly as widely. Back in March, we were having all sorts of problems with testing. Testing was taking weeks for results to come back. We weren't testing nearly as many people. We were testing low thousands of people daily, and now we're testing 30,000, 40,000. So when you're looking at the second wave numbers, keep that in mind, because what that tells me is that the first wave was probably some really large amount worse than what the official numbers said and what the numbers I counted said. So if I'm looking at April and March and I see a 600, in my head, I'm doing a calculation to think it's a lot worse than that. And when I'm looking at the current wave, I'm thinking, well, we're here. It's really bad. I don't know if we're right back to March yet, but that doubling time is what I care about. Because if in March we missed 90% of cases, well, right now, if we're doubling every 10 days, it doesn't really matter what the real number was in March. We're going to hit it by the end of October anyway. So what matters is doubling time, because 300 becomes 600, becomes 1,200, becomes 2,400, and then all of a sudden you're up to really crazy numbers. It doesn't take long when you're doubling every 10 days.
I wanted to be a bit Trumpy and be like, wait a second, are you saying more testing means more cases?
We test better than anybody in the world. Our tests are the best in the world, and we have the most of them. By having more tests, we find more cases.
I'm kidding. I don't really want to get into that.
Well, no. I mean, more testing doesn't mean more cases, but it does mean that you catch more cases. So in April and March, Ontario had a really hard time with testing. And because they were having such a hard time with testing, they were rationing testing, essentially. They were saying, only get tested if you're sick, right? Only get tested if you're kind of seriously sick. So at that time, we were seeing a lot of older, sicker people test positive. And now the testing numbers are so much larger that still, for the most part, anyone who needs to get tested can. It'll take a while. Some of these testing sites are overloaded and it's not a pleasant place to be. But if you want to get tested right now, you largely can. And that means younger people or people who are concerned that they've been exposed but don't yet have symptoms can go get tested, and some of those people will show up in the numbers. So it's important to keep that in mind. It's not that the testing is causing cases, it's that the testing now is catching more cases. So that means that if you're trying to compare the fall to the spring, you do got to keep that in mind, because it does kind of skew a direct comparison. So I try and keep that in mind when I talk about it.
The other number that's kind of interesting now is deaths.
Yeah.
Because they're much lower. And we've had some doctors talk about some of the reasons for this. And one of the things is that perhaps that these cases are skewing a lot younger. Is that right?
It totally is right. And it's all kind of tied to the same thing. Right now, we have a lot of new cases, but a lot of those cases are in people under 40. And almost no one who tested positive in April and May, or relatively very few people who tested positive in March, April, and May, were young people. For the most part, we were catching people with the disease who were in their 50s, 60s, 70s, 80s, right? And then it was after the disease started to be in the community, spreading in the community in March and April. It was several weeks after that it got into our long-term care homes in Ontario. And our long-term care homes are the main place where people died. The total number of deaths in long-term care homes, nursing homes that house people between 80 and 90 who have health issues and need constant 24-hour care, the sickest of the sick, those settings account for like 2/3 of Ontario's deaths. I believe it's 1,800 deaths in long-term care homes for 2,800 deaths total. So that's the main reason people died in Ontario, is that COVID-19 got into long-term care homes. And so far in the fall, it hasn't got back into long-term care homes. So that's good, but I don't know if it's going to stay that way. There's reason to think that we should be better about keeping it out of long-term care homes, but that's still an open question. And the other thing is that if we're very early on this second wave, keeping in mind what I've been talking about, the numbers not quite being the same as what they are in March in real numbers, then maybe that means that we just need to wait a little bit. And then those deaths numbers will start to spike again. There's, of course, a lag between when someone tests positive and when they die, right? It takes time to get the disease, go get tested, have that number show up in the records, and then your symptoms get worse and you need to go to hospital. And then you need to go on a ventilator. And maybe weeks later is when you die. It can take a very long time for someone to get it and then die. So it's natural that we wouldn't see death numbers spike until after case numbers have spiked. It's just so far, those death numbers aren't going up very quickly yet. That's good. But whether it'll continue is something that we'll be watching closely.
We'll be right back.
Now, where are the gaps in the information that we're getting? One of the things that on the heat map, we're hearing now that the waterfront is now a hotspot. We've heard some workplaces have outbreaks and also some, places like the brass rail, but not others. What's missing from the information that's being shared or not being shared?
I think what's missing is just information. I don't think we know enough about where the virus is spreading more often than not. We're being told about anecdotes, right? We've been told about a couple of cases now of spread at strip clubs, the Brass Rail and another one in Toronto. And I think we're being told about those because those are very scary to public health officials. Public health officials want to be able to contact trace, which means they want to be able to know that when someone tests positive, they can find other people they've been in contact with. And for all sorts of reasons that you can probably guess, that's really hard at a strip club. So I think they put out a public notice to try and tell the public, hey, maybe you gave a fake name, but check in with your public health officials. But when that's the only example, or one of the very few examples that we're getting told to the public, that leaves people in the public with, I think, probably quite a skewed view of where the virus is actually spreading. I don't think strip clubs are the main source of COVID-19 transmission. I probably don't think that nightclubs are either. But I don't know that because we're not being told about most outbreaks. We're not being told about most, transmission chains. Some public health units have done a really, really quite a good job of sharing detailed accounts of how COVID-19 is spread in workplaces. Windsor, Essex put out a great breakdown of a workplace outbreak. And that is super helpful because it gives it sort of a detailed person-level kind of account of how it's spread between people. And that's great. It's just that for most cases, we don't have that. And it may be that public health officials don't have that information at all, or it may be that they're not sharing it with us. And either one is kind of tough because we're all in the dark and we're all making assessments based upon what we're seeing reported to us and what we're seeing in the news and what we're seeing from public health officials. So it may be that if 20 and 30-year-olds see the news, they look at the strip club and they laugh at those people and they think, who's crazy enough to go to a strip club? And yet they're also having a party in their condo. And maybe that's much more risky, but we don't know, right? So what I would hope is that over the next little bit through this second wave is that we start to get more detailed accounts of this for a public health purpose. I think it's important to tell people this stuff so that they know how to gauge it and they know how to, change their behavior. Right now, we're hearing a lot that it is on the public to change their behavior. But I'm not sure the public knows quite exactly what they're supposed to be doing right now.
I think we're all living in an age of sort of risk assessment and cautiously trying to proceed with life. I'm a parent. My kid is currently in school right now. I mean, I've seen all the scary numbers across the country and in other jurisdictions. Do we have any numbers on kids in schools yet?
It's very early. I mean, it's only a couple of weeks since kids have been going back to school. So it's probably too early to expect to see the scary outbreaks that we're all kind of worried we might get. Now, that said, the Toronto District School Board puts out COVID-19 advisories for its schools. And if you're a parent with a kid in the TDSB, you should be watching that. Right now, I don't see anything there that's hugely scary. There's several schools in which there's been confirmed cases among students and staff. I think it's about a dozen. But all of those schools have just a single case. So that's not super concerning. What would be concerning is, like we saw with long-term care homes, for instance, what would be concerning is if we started to see large outbreaks happening inside these facilities, and then you probably see them closed. But we're not there yet. And I don't know, I can't predict that there's going to be big, scary outbreaks inside schools, but I don't see any reason to think that they're immune from outbreaks. Back in March, one of the things we didn't understand very well was, spread amongst younger people who don't get that sick. And it turns out, based on what we've learned over the course of the year, that happens. Kids get the disease and they can spread it. And they may not get as sick as often as older people, but it's still possible to spread it. So I don't personally think there's any reason to think that outbreaks won't happen in schools. I think the question is, can the TDSB and can health officials manage it properly? And so far, I don't know that they've been tested. So we're going to keep watching.
Is there anything that we've learned from the March-June timeframe that can inform this? And I think specifically, this is one of the things you talked about, sort of the lack of information. If we want to avoid a full-scale shutdown, could we not do it perhaps sector by sector or something, if perhaps more information would be shared about where some of these outbreaks are? I mean, I'm just spitballing. What do you think about that?
The research and what epidemiologists are finding from the disease has advanced hugely from March. In March, I think less than 50 people had died in the province. And now it's 3,000, nearly. So March was the very, very, very beginning. And yet in March was when the province had declared a state of emergency. And March is when, all businesses were closed. So when we were first taking these really severe lockdown measures in March, it was because we didn't know what was coming. And what was coming was really hard, and it was really bad, and a lot of people died. But since then, we've learned a lot about the disease. One of the main things we've learned about the disease is that it is spread through the air to an extent. So, whether that's what doctors will call a droplet spread or aerosol spread is still kind of an open question, but it doesn't really matter. What matters is that it can spread between people through the air. And what the science says is that indoors is a much higher risk than outdoors. So in March and April and May, we were seeing things like High Park closed for the cherry blossom festivals, right? But now when we're looking at what we know, it may be that was unnecessary. We had a huge outcry in Toronto over younger people hanging out at Trinity Bellwoods Park outdoors. This was back in the spring again. When the weather turned, I had a whole bunch of people who were cooped up in their condos went out to Trinity Bellwoods Park, and it caused an outcry. And we really cranked down on that. But maybe that's not so necessary in a pandemic in which the disease is mostly spread indoors. But I don't know. These are really tough questions for public health officials. And public health officials are going to be looking at the science very, very closely, and they're going to be very cautious. But a lockdown is itself really, really, really hard. So I don't know if there's going to be much appetite amongst politicians and public health officials to get on it quickly. Back in March, when we were going into the first lockdowns, when we were declaring a state of emergency, when we were shutting down schools, case numbers were much lower than they are right now. The recorded case numbers were much lower than they are right now. Deaths were very low. The daily cases were very low. We've eclipsed that level already in terms of the official numbers. So what comes next is, I guess, if it gets hard enough for politicians and health officials to have no choice. And I don't know if that's going to come, but it could.
I think that's the thing. This is the biggest jump in 3 months, and I see nothing changing for these numbers to go down. Is that fair to say?
So far in the fall, we haven't changed anything that would make these numbers go down quickly. So yeah, I think you're right. Unless we change something, or unless we get lucky, or unless there's something that we don't understand that happens, those numbers are probably going to keep going up. In March, in the spring, those numbers went down after we did a lot of things. Mask mandates came in, business lockdowns. We did interventions in long-term care homes. We sent the army in. We did all of these things. And it was after that cases started falling. Cases were falling from May, June, July, August, a very slow decline. And it may be that those things had a huge effect. It may also be that cases just went down because it was the summer. It might be that there's a seasonal effect to this disease that we haven't quite put our finger on yet. One thing that gives me pause is when I look at the example of Australia. So Australia is in the Southern Hemisphere, so it's just coming out of its winter, right? But its second wave happened in its winter, and its second wave was much bigger than its first wave. Far more people died in Australia over its winter than in January, February, April, March, than in the spring, right? So I'm worried that if there is a weather effect, or if maybe it's more like a being indoors effect, that could kind of make things a lot worse for us. That's what I'm concerned about. I'm concerned that may be a big driver of this, but I don't know if it is. No one knows. We're all kind of in the dark.
We all know winter is coming. So, we're going to be watching these numbers. I want to thank you so much today for taking us through them.
Sure. Thank you.
Ed Tubb is an assignment editor at The Star, focused on crime, justice, and COVID-19 data. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Rajat Mudler, Adrian Chung, and Saba Etisaz. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.